Hello and welcome to today's presentation on the cervix. So today we are going to look at the changes which takes place during pregnancy, labor and puerperium. Now, certain changes occur during pregnancy, labor and puerperium under hormonal influences, and the hormones which are involved in these changes include the estrogen, progesterone and relaxin, as well as some enzymes such as collagenase and elastase. Now, majority of these changes we find are due to the actions of collagenase and elastases, as well as the engagement and descent of the fetal head within the lower uterine segment. So, what are some of the changes that takes place in the cervix? We find the first change to be an increase in the cervical mucus production. Now, under the influence of estrogen and progesterone, cervical mucus is produced by the cervical columnar cells throughout the menstrual cycle. And so, during ovulation, the mucus that we find is stretchy and stingy in consistency, and this helps or facilitates the movement of the sperms by means of providing an optimal environment for its ascent into the uterus, as well as storage and its survival. Now, after ovulation and during conception, we find that the progesterone is now produced entirely by the corpus luteum, and so the mucus produced is now reduced in its volume and fluidity, and so it has now become tacky as well as viscous, and this prevents or discourages spermatozoa and bacteria ascent into the uterus. Now, in the early, pregnancies, that's by the fourth to the sixth week of gestation, the cervical edema takes place, which leads to softening of the cervix, which we refer to as Goodell's sign. And since the main function of the cervix at this time is to retain and protect the product of conception, it increases its mucus secretion, which forms a plug that we call operculum. And this operculum fills and closes the cervical canal, thereby reducing, the risk of ascending genital tract infections. We also have softening of the isthmus, which we refer to as the Hage's sign, taking place by the sixth to the eighth week of gestation, which also leads to the softening of the cervix. Now, by the 12th week of gestation, there is increased vascularity within the cervix or the cervical stroma, and this creates an ectocervical bluish tint, which we call the Chadwick sign. And so the Chadwick sign is the cyanosis of the vagina and the cervical mucosa. Now, as labor approaches, we find dramatic changes of remodeling taking place in the cervix, which allows the passage of the fetus. Now, remolding can be subdivided into four overlapping phases. And so we have the softening, the ripening, the dilatation, as well as postpartum remolding or repair of the cervix. Now, when we look at the last 2 weeks of pregnancy, or even before that, getting to the end of pregnancy, we find cervical edema, collagen reorganization, as well as increased vascularity and also rising levels of relaxin, leading to the softening of the collagen fibers of the cervix. And in the last 2 weeks of pregnancy, there is engagement of the fetal head, and this exerts pressure on the internal os. And so the cervical canal is taken up into the lower uterine segment in the primigravida. So over here, we find that there is no more cervical canal. or the cervical canal is no more it's no more fusiform, because by this time it has turned into a funnel shape, and the widest part of the cervical canal now is at the internal os. Now, just before labor, the external os barely admits a fingertip, as the cervical canal has reached half of its length. And so we say the cervix is ripe in the primigravida. But this is not the case in the multigravida. In these people, there is no engagement by the fetal head until labor has begun. And this is usually partly due to the loss of, abdominal muscle tone due to successive pregnancies. So since there is no, pressure on the cervix, effacement and dilatation of the cervix takes place at the same time when labor begins. And so we say is uh, ripening is due to the high collagenase activities, which breaks down the collagen, or breaking down the collagen fibers, leading to decreased collagen concentration and increased collagen dispersal and increased collagen solubility, so that it can be easily removed. So as I've just explained, in the primigravida, effacement of the cervix commences in the last week of pregnancy, and it completes during the first stage of labor. And once completely effaced, the external os begins to dilate. But in the multigravida, it is more common for the fetal head not to engage until labor has established, and so it is not applied to the cervix until that time. Now, in response to uterine contractions, the already softened cervix begins to efface and dilate as a result of the pressure being exerted either by the fetal membranes and or the presenting part. And so the first stage of labor is the stage of cervical dilatation, and it starts with uterine contractions, which brings about dilatation of the external os, and is completed when the cervix is fully dilated, that is up to 10 centimeters dilatation, which will allow for the passage of the fetal head. Now, the cervix takes up as the longitudinal muscles which extends from the body of the uterus to the cervix contracts and retracts, thereby leading to reduction in the cervical length, and it becomes thinner as it merges or fuses into the lower uterine segment. Now, when no cervical canal can be felt, we say effacement has, taken place, and we can also say, taking up is complete. And by this time, you can feel a thin rim of cervix right over the fetal head on vaginal examination. So we say that dilatation is as a result of decreased collagen concentration and increased vascular permeability. Also, as a result of interleukin 8 activity and cytokine activity, together with leukocyte infiltration of the cervix and protease activation and collagen degradation. So this is what leads to dilatation of the cervix. Now, looking at the image on our right, it's depicting effacement and dilatation of the cervix. And so, as you can see in this diagram, effacement hasn't started, and so the cervical length is still the same. So you can find the length of the cervix being 4 centimeters. So you can see the length over here. Now, when we look at the second diagram, which is B, the longitudinal muscles which extends from the uterus to the cervix are contracting and retracting, and so the length of the cervical canal is reduced by half of the image in A. So over here we see that the cervical length is 2 centimeters. Still, we don't find any dilatation of the external os. Now, when we look at the image in C, we find that there is no cervical canal, and so we say the cervix is fully effaced. And in the fourth diagram, that is D, what we find is that after the effacement of the cervix, the external os began dilating, and so we can find 3 centimeters dilatation of the cervix, and in E we have up to 8 centimeters dilatation, and so the cervix will continue to dilate up to 10 centimeters, and this will commence the second stage of labor, which is the expulsion of the fetus. Now, I have a second diagram which is also depicting the same thing. Here being, the complete cervix, which is not effaced. Here we have 50%, effacement with no dilatation. And as effacement completes, we find 1 centimeter dilatation of the external os. And over here we have 7 centimeters of the external os being dilated. And here we have a fully dilated cervix with the fetal membranes just bulging over here. So this is what takes place during labor, or the first stage of labor. So now in puerperium, what happens is that there is restoration or repair of the cervix. And so immediately after delivery, the cervix begins to close and return to its non-pregnant state. And so by the 6th week postpartum, the cervix should have reformed with an internal and external os with a cervical canal in between them. Now, the external os no longer closes completely like before, but now it has become slit-like. It looks like a slit-like, aperture, which is large enough to admit a fingertip, and this is what we refer to as the multips os. Now, so we say that postpartum restoration is due to a decreased inflammatory process in the cervix, as well as decreased tissue dehydration and decreased mechanical stretch of the cervix. Then, most importantly, an increase in the density of the collagen fiber at this time. So this is what helps in the repair of the cervix. So in this diagram on our right, what we find is the various stages that the cervix goes through right after delivery. So as you can see, this is at delivery, and by 8 hours you see that repair has started taking place. So this is what I meant by a slit-like, aperture. So by the 8th day postpartum, this is how the cervix looks like. As you can see, it is reforming. It is now becoming, oval in shape. Then by the 14th week, you can see, it has almost fully repaired. So by the 17th week up to the 24th week, you see that the cervix looks so beautiful and has, repaired itself. And by 3 months, we find that the cervix, can admit a fingertip, which we refer to as the multips os. So this is all that I have for you in the changes that takes place in the cervix during pregnancy, labor, and puerperium. Thank you very much for your attention. Bye bye.